Hello, I'm Tu Kim Lam. Welcome to the medical news on SBTN from Washington, D.C. In the medical news in 2008, Dr. Tran informed us about the studies on vitamin E and selenium and prostate cancer. In this edition of the medical news, Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia, he has been following the study from August 2001 to May 2011. He will give us the report on the result. Welcome to our medical news show, Dr. Tran.
Welcome to our shows and hello, Mrs. Lam.
Dr. Tran, 3 years ago, you already talked to us about vitamin E. Would you please refresh our audience about what vitamin E is and what's the role regarding to our body?
Vitamin E is very important because in the body, and vitamin E is one of the 4 vitamins. Is soluble in fat. This means lipid soluble vitamin. We have A, D, E, and K. This is the 4 key vitamin in fat. Now, vitamin E is very important because, as most of the scientists believe, the vitamin E is very important antioxidant vitamin. Vitamin means very important, very small amount of that substance, but the body cannot make it. And we have to get the vitamin from outside, from food, from any other sources. And vitamin E is important because for year and year, people still believe that vitamin E is very important antioxidant. What does mean antioxidant? Anti mean against. Oxidant mean anti-oxidation of the tissues of the body. Now, outside in the nature, you can see the oxidation of all kinds of things going on in the world. And in the body, we have the same thing. The oxidation of the organ, of the cell, that create the aging process. And the scientists believe the aging process leading to cancer, different form, and different organ in the body. So they believe with the vitamin E, hopefully we can fight again or prevent again the cancers of different form of the organ in the body. So that's why we call vitamin E is antioxidant. And right now we see all over in the store, they selling vitamin E of high doses, either 400 IU, international unit, or 800 IU. So that's we can see right now all over the store in the United States and all over the world.
Sir, what would happen, what kind of symptom do we have when our body needs vitamin E?
The vitamin E is rarely deficient, but in many cases, like people with the poor absorption or have chronic diarrhea or have the chronic disease or surgery, they cannot absorb the vitamin E. Then they may develop symptoms like very weak because of the muscles is not strong. And number 2 is trouble of transmission of the nerve and causing tingling numbness and also cannot walk. They call it ataxia. They walk unsteadily. And thirdly, is the vitamin E may causing the problem for the retina. And it causing the changing in the pigment and retina, causing blindness as well. And also vitamin can cause a chronic anemia when low in red cells in the body when the deficiencies of the vitamin E is so long.
So where can we find the foods that have vitamin E?
It's very easy to get the food with the vitamin E because most of the vitamin E is contained into the oil, like olive oil, corn oil, or soybean oil. And beside the oil, you can find most of the nuts, like peanuts, almonds, or any kind of nuts. And usually, almond is very high content of the vitamin E. And the fruit is kiwi is the most contain the most of the vitamin E among the other ones. And these are the most commonly we can eat, and people eat easily, and rarely we have really low in vitamin E.
So in 2008, you informed us about the studies that the National Institute of Health using vitamin E and selenium to do these studies. So would you please explain to our audience what selenium is and what kind of role that selenium takes in our body?
Selenium is very important because I think as most people know about vitamin E, but few people are aware of the selenium because it's not vitamin, it's a mineral. And because we call it micronutrients of the body, but the body needs very tiny amount of selenium for its function. It's quite important because the selenium incorporate into the cell with the protein and create the enzyme called selenoprotein, an important antioxidant enzyme. And beside that, the selenium has been used widely in the market, in the glass making and electronics, because people is using selenium as semiconductor in the past, but right now they're replaced by something else. And also selenium was used in the medicine to treat the infection of skin caused by fungus. So the name of the medication is selenium sulfide. You can find over the counter in the shampoo and some kind of form of selenium to treat the fungal infection of the skin.
So where can we find the selenium? In the food?
Selenium you can find everywhere. I think it's mostly in nature because so far it's usually is in the soil. And the plant using the soil and grow and contain a certain amount of selenium in the plant, especially in China, and close to the area with sulfide area or a coal mine, and also has a lot of selenium in the soil. We can find selenium in nuts, fishes, and some mushroom also, and certain plants like also, especially in China, they have a lot of plants that contain a lot of selenium that we discover because people get toxic when eating a lot of plants.
So how much do we know how much do we need selenium for our body? And in any case, do we ever short of selenium, or what happens if we have too much selenium in our body?
Selenium, really, studies show that we need only about 10 to 20 micrograms of the selenium. That's the requirement of the body. If you go beyond that, you get toxic from the selenium. And because already that's tried in a group of people in China, when they become toxic, the symptom is they have a special odor in the breath. They call it garlic odor. I mean, it smells like they're eating a lot of garlic. But really, this is a symptom of toxic from selenium. The hair loss, they have the nail become fragile, easy to break. And in the worst case scenario, they may develop cirrhosis of the liver, meaning the liver is not able to function and become hardening. That's called cirrhosis of the liver. So these are the symptoms of people who really get toxic when using a lot of selenium.
So in 2008, you shared with us that the study that using vitamin E and selenium trying to find the result to see if we can use this vitamin E and selenium to suppress or prevent prostate cancer. Before we talk about the study, would you please tell our audience what is prostate?
The prostate is a very important organ of the man. It's like ovary for the ladies. Prostate because keep the function of maintain the activities of the sexual related activities, because some of the sperm from the man it come from behind the prostate. You can see on the picture of the prostate, and during the sexual relationship, the sperm will go through the prostate. It's not go through the bladder, but they use the same route to come out. And therefore, throughout the years, usually the prostate had to be like very functional. And when people get older and older, especially as men, they develop enlarge of the prostate, or they may develop cancer of the prostate. That's a concern. That's why most of the scientists try to find out something in the food that we can eat, we can use either to decrease the risk or prevent the cancer of the prostate.
So now let's talk about the studies. Can you explain to the audience how was the study conducted?
The simplest explanation or interpretation of the studies is the National Institute of Health coordinate the study, and they really able to get about 34,887 volunteer men, and they divide into 427 sites in the United States, Canada, and Puerto Rico. Now, any man over 50 years old, especially the African Americans, they choose this early because they believe that the African American may develop cancers sooner than the other group. But for the other ethnic group, the age is over 55. And then they go through the examination and the blood test to show that these people has no evidence of any cancer. So that's the reason why they choose that. And then they divide into 4 groups. The first group is about 8,700 people. They give the selenium. The second group, the group 2, they give the vitamin E, is 400 IU, international unit. And the third group, they combine to give the selenium and vitamin E. And the fourth group, they give the pill, but there's nothing in there. They call it placebo. So they compare and follow for 10 years to see which group develop which kind of problem, or whether they can really helping decrease the risk of cancer of the prostate, and including the other cancer in the body as well, not just the prostate. So that's the design of the study, to prove whether selenium or vitamin E may help to decrease the incidence of the cancer in men.
So what is the result of this study?
Results really is very interesting because it's give us the ideas that when people take the vitamin E over 400 or about 400 IU, the incidence of the cancer of prostate is increasing. Compared with the group taking nothing, only 527 people get cancer of prostate. For people get the vitamin E, they get about 620 people develop cancer of prostate. So therefore, statistically, it's very meaningful because they make the conclusion that people really take high dose of vitamin E may increase the risk of cancer of prostate. Now, it doesn't mean that vitamin E causing that, but people taking high dose vitamin E may increase the risk of developing cancer because we don't know exactly what's causing cancer of prostate.
So before we closing the show, would you give us the conclusion of the vitamin E study and cancer?
The conclusion is from National Institute of Health, and they concluded the dietary supplementation with vitamin E increased the risk of prostatic cancer. Number 2 is high dose vitamin E is not highly recommended for daily use. And any hypothesis or prediction in medical science could be proven wrong in study in human being, because human being is a little different body and different action inside that we don't really know completely. And be careful when using the medication known by tradition only. Because if we just believe, because in the past we see it happen and we believe it working, but reality, the study may show this may be wrong.
Thank you, Dr. Tran. That is all the time we have for today, Medical News.
Again, thank you for joining us and for today's presentation. And again, thank you, Mrs. Lam.
You're welcome, sir. Thank you, sir. That was Dr. Sang Tran, who just shared with us on the result of the studies of vitamin E and prostate cancer. We hope that the information provided by Dr. Tran has shed some light in this health issue. That is all the time we have for the medical news. If you have any additional question about this issue, please talk to your family physician. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the medical news. Until then, have a blessing one.